Welcome back to another episode of the Benefits Insider. I'm your host, Chris Hamilton, and today I want to share a common question that I'm getting, especially this time of year as companies are trying to determine how to manage their renewals. And that question is, how many plans should we offer to our employees? And the answer might surprise you. If you want to use your benefits to attract or retain talent, you have to offer something they can't get anywhere else. So as you're going through the renewal process today, perhaps you have one plan, two plans, just think about the plans that you offer to your employees. Many companies grapple with a number of things, cost being a big one, but also how do we educate employees? How do we get them to understand their benefits and use them appropriately? Because the way they use their benefits, particularly the medical plan, drives a lot of the costs in your company. And so I was just on a call with a prospective group that we're working on today. They've got about 100 employees, and they offer 7 different health insurance plan options to their employees. And I found that somewhat interesting, and I can imagine that it really comes from a place, a good place. People, and I agree with this, that choice is important for employees to be able to pick what's best for them and their families. And so in my mind, when I heard that, I thought to myself, wow, that's kind of wild. It can be confusing, but I know that it comes from a good place. Their broker was probably trying to make sure everybody had something that might fit what they need. And I think about my own situation. Before I got into the benefits industry, and I was in corporate finance, I used to call a friend of mine that was a broker and said, hey, here's my plan options. Which one do you think makes sense for me? And I have an MBA. And that's how confusing health insurance can be for highly educated people, much less somebody that doesn't deal in numbers on a day-to-day basis. So I think about 7, that can be completely confusing for your average employee. So what is the right number? We see clients that have as few as 1 plan, and I would say 7 is the highest I've seen for a mid-sized business. But I put this into perspective. I think less is more. My sister-in-law just contacted me asking me to help her pick out her benefit plan for her family, and she works for a Fortune 500 company. You know how many options they get? 2. Really simple. And it goes back to the way they've designed those plans. I think it's actually pretty smart. But for our practice, what we typically recommend for most employers, mid-market size, the best offering to meet 95% or more of your employees where they are is 3. And I'll explain to you what I mean by those 3 options. You could call any of 3 things, good, better, best, silver, gold, platinum, you name it. But I'm going to explain to you why that 3 seems to be the best fit for most companies. If you think about your workforce, just picture your employees, right? There's a couple of different ways you could dissect your population, right? By generations. You probably employ at least 4, maybe even 5 generations of people in your company. And think about why that's important. 1, they use benefits differently. So if you think about somebody who's a baby boomer, perhaps their need for medical service and the type of medical services they're taking and using is different than somebody who's just now entering the workforce and is in their early 20s. You probably have a wide range of incomes. Typically people who are just entering the workforce, not always, there's exceptions, right? But typically they're not the highest earners, right? And perhaps, based on the job types that you guys have, you might have some older folks that are not highest earners either. So you might have a wide range. You call it $30,000 a year up to $300,000 or more. So you got kind of these 2 things overlaying each other, generational and then incomes. So when I think about, people, what they need and how much they have to spend, the way we typically would design for a company that says we need to offer something that meets the needs of 95% of our employees or more, it's those 3 plans. The good, better, best is what I'll call it. Or really what we call it is base, mid, and high plan. And so you have 3 distinct types of buyers of health insurance in just about every single company. You have the lowest cost buyer. They're typically looking only at what is the amount that's going to come out of my paycheck. That's the only thing I care about. Do I have coverage? and what's the cheapest amount I can pay for. And really that comes down to people that probably just want the protection, but they don't use health insurance very much. And then you have people on the opposite end of that spectrum. Typically people who are more established, higher earners, they don't care what the insurance costs. They want the best that the employer is able to offer to them. They want the platinum plan, no questions asked. And so that's going to be where that high-end plan comes in, the buy-up plan. But then you have folks that fall somewhere in the middle. Typically that base plan, the lowest cost plan, is for most companies is going to be a health savings account eligible plan, commonly just referred to as an HSA plan. It's a high deductible with no copays. That's why it's the cheapest. But there's a lot of people that really want the lowest premium, but they need the safety of copays. Now, I want to preface this, and I've said this in prior episodes. I am not a fan of HSAs as the base plan option. I personally am a fan of an HSA. I've owned one for, it probably 15 years or more now. But I don't believe they're right for most of your employees, because you have a lot of employees that are buying insurance because of the lowest price plan, but they don't understand how it works. And then they're shocked when they go to use it because they now realize, wait a minute, I haven't been saving any money in this account. It's going to be $200 to go see this doctor. And oh, by the way, the medication he prescribed me is $500 or $300. A lot of our employees in perhaps in your company, they're living paycheck to paycheck. They don't have that kind of money sitting around to pay for an emergency. And if they do have that money, they probably need it for something else besides a doctor's visit and medication. There's a lot of people in my industry that would say that's a good thing because they need to see what healthcare costs and they'll become better buyers. But here's the deal. For the average American that's walking the streets, they're inside your office right now or inside the manufacturing facility, they're driving your truck. Healthcare is complex. They don't understand what things cost. And in that moment when they need something, they need to know they have a way to pay for it that's not going to break their bank. And for that reason, I don't think HSAs are the right fit for most people because it's hard to educate. It's hard to get them to commit to saving money in an account for that time that they're going to actually need to use it. And there's a small percentage of the population that they're awesome for. Typically folks that are willing, that understand what it is, they understand how to use it, they understand what to expect when they go to use it, and they're willing to put money aside for their future health care. And as we've gone in and we've tested with several of our clients have been willing to be guinea pigs, just kind of a experiment with them, if you will. We build plans, one that has a copay and one that does not, that has an HSA. We build them to where we can price them almost identically. We let the employees pick. And I'll never forget this. There was 2 clients that we did this for several years ago at this time of year. We went in and we offered them a plan that had copays and one that was this high deductible HSA. They charged the same exact amount for both of these plans. Going into this enrollment, I'm thinking one of these companies in particular had 85% of their employees were enrolled on an HSA. As soon as we offered them a plan that was priced similarly, identically, but it had copays. Now the deductibles might have been a little bit different to get the pricing right. All those employees, with the exception of 13%, the enrollment in the HSA dropped from 85% to 13%. Everybody else shifted to this plan that had copays. So some of you might be some of my counterparts in the industry and think like, Chris, that's a bad idea. Why would you do that? You want people to see what things cost and have to pay out of pocket for it. Well, the thing that we typically see when it comes to these HSAs, and I know I'm getting on a rant right here, but I think this is really important for everybody to understand, is people on your HSAs that don't have money to pay for healthcare, you know what the first thing they do is? They delay their care. Oh my gosh, I've got chest pain, or man, I'm having this ache and it's not going away, but man, I don't want to pay. I don't know how much it's going to cost me, and I'm just not going to go in. And they don't go in until it's something really catastrophic. And we saved $500 because they didn't go into the doctor, but now we're paying tens or hundreds of thousands of dollars for a condition because it's become catastrophic. It's become cancer. They had a heart attack and now they're sitting in ICU when they could have gone in and had it properly addressed on the front end. That's the first thing that we see. You don't see you'll see year one savings in claims by putting in an HSA, but what you don't see, what people don't connect the dots for, is if you follow those patients based on the conditions that they've got. And most of our clients are self-funded, or most of my clients are self-funded. We have that kind of data. I can tell you who has chronic conditions on an HSA that's not getting care. We call it delays in care or gaps in care. So they become catastrophic claimants at some point. Their risk goes up over time because of the second thing I'll tell you about people on HSAs, that when it's not a right fit for them. When they need chronic medications, hypertension, diabetes, high cholesterol, those sorts of things, they delay filling their medications regularly. So you'll see somebody that's hypertensive or diabetic even. That's probably the biggest prevalence of conditions that we see where we see this. Instead of getting their medication every 30 days, they're getting it every 45, every 50, every 60 days. What does that mean? Well, they're probably taking half doses, or they take it every other day. They're not taking it regularly because of the cost primarily. So side rant to that, but we do see a lot of HSAs. The base plan here at Hotchkiss is an HSA. We spend a lot of time talking to our employees, making sure they're educated, and the people that are enrolled in those plans, they understand them, they contribute money to them. Again, personally, I'm a fan. I like an HSA. I do not want to take away my own HSA, but what we see when we consult with most of our clients, it's not the best fit for most of the employees. It's okay to offer it. We still recommend that you offer it. There's a lot of people that benefit from it, particularly higher comp people, executives, and even people who aren't high income earners, but if they understand it and they're contributing money, setting it aside. We have seen people who are not in those high income brackets, but they're chipping in $50 to $100 every single month, and they're healthy, or maybe they're not, but they're still chipping in money, and they've developed these balances in their HSA accounts of thousands of dollars. That's a good use. That's a good person to be in that sort of a plan. So moving on from the base plan, the HSA, I mentioned this higher deductible copay plan. This is for people who want the premium reduction, has a higher deductible perhaps, but they've got that safety of a copay. They know if I'm sick, I can walk into a primary care or an urgent care, and if I'm prescribed a medication, I've got the safety of having a copay. That's that mid plan. Then the third plan is that buy-up plan. That's the platinum level, lowest deductible, lowest copays, highest premium because of that. The way we manage costs, and this goes back to the whole Benefits Insider approach, is by giving people kind of this alternate channel to buy healthcare when they need it, whether it's medications, whether it's imaging, whether it's surgeries. You can even do this for inpatient hospitalization procedures. Using your insurance card, that logo that's on it, think about the one that you guys are using today, that's the highest cost side of healthcare. PPOs, they actually monetize their network in a number of ways. I've talked about it in previous episodes, but there's a lot of conflicts of interest. Think about this. If you've ever gone in and asked for a cash price versus what your insurance company pays, typically it's less. People always ask me, why am I able to use GoodRx? That's a different conversation, but GoodRx are these other discount programs and get a better price. Sometimes if I pay cash, I can get a better price than my insurance pays. Why is that? Well, that's what we've talked about in the past. So we give employees access, particularly our self-funded or partially self-funded employers. Their employees have access to get health care. That health care is a fraction of the costs. And then by them being part of the solution of health care, we waive their cost to access that health care. So we're able to waive their deductibles, waive their out-of-pockets, waive their copays. So think about that now, that employee that's on that highest deductible copay plan, whereas a lot of my peers would say, hey, why would you give somebody this copay plan? You get them on the HSA, it's going to help reduce claims costs. Maybe it reduces the initial claims costs in year one, but what about when it's catastrophic? Remember? So now we don't want to create barriers to healthcare. We want to remove them. And you can actually provide more healthcare to your employees. They'll go in and get the care that they need when they're sick. And if they're willing to go through the proper channels, then they can access that healthcare for free. Now, if they don't want to go through those channels, then they've got their traditional logo network, PPO network on their card, they're going to be subject to their normal copays, normal deductibles, and out of pocket. So you're kind of giving people a choice, right? You can access healthcare at the regular way that you've always done it through Door A. That's your ID card. That's the logo on your ID card. Or you can go through Door B, which is this concierge, coordinated, pre-vetted, high quality, lowest cost providers, and it's completely free to you. So the choice is yours. So I hope this was helpful. No, I spent a lot of time talking about HSAs, but it's important to think about these things as you're designing your plan, because all of us, we deal with this at Hotchkiss. I know you're probably dealing with this at your company. You're employing a wide range of generations, incomes, buying preferences, but you really can distill this down into 3 plan designs, maybe a 4th, but I would still stick with 3, kind of the good, better, best, base, mid, and buy up. But I hope it's helpful. If you've got any thoughts or questions about what this might look like for your company, feel free to send me a message. Happy to help. But until next time, use these tips to add more profitability to your bottom line and more money in your employees' paychecks.